Thank you for everyone being here on Thursday evening. I am so excited to share my journey with clear aligner and also being able to share the experience that I have of how to implement the clear aligner therapy into your practice. So let's go ahead and get started. My name is Dr. Yusun Kim. I'm a general dentist from Elverson, PA. I am heavily involved with the technology and, all about providing that comprehensive care for the patients. And when you're thinking about clear aligners being a part of your practice, that's actually what's going to propel you to be able to give that comprehensive care for the patient. So let's talk about some of these concepts of what's behind it. I'm sure everybody on this call is pretty familiar with what it is and how it's going to be. So let's talk about how this can be actually be something that's going to be meaningful for your practice. So obviously, clear aligner has been around for a while now. It's really, really well accepted by patients, and a lot of times patients are the ones who's going to be asking for this type of treatments for your practice. Obviously, it's great because it's going to be nearly invisible, so it's attractive, and it's also not as cumbersome for the patients. It's convenient for the patients. For me, from the practitioner side of things, the hygiene part of it is a huge thing. And then being able to actually have those options available for the patients, that's really huge for the patients, obviously, too. So when you're thinking about implementing clear aligners to your practice, and when you're thinking about what it means to have that for your practice, this is all about having that conversation with the patient. Because a lot of times patients come in and they're not even thinking about some of these things that they have, or they've been thinking about it. They don't really have thought about what it was going to be like. But having that initial conversation to start and having that thought process going, I think that is going to be the key. And then for your end, to make it easier for the patients to be able to accept that, and for your team to be able to implement that easy for your practice, and then patient to actually accept that, that whole thing just becomes a really nice flow for you and for your practice when you have all these things lined up for yourself. So let's talk about how that conversation starts. Everything starts with diagnosis. So when you're thinking about the diagnosis, I'm not just talking about a patient comes in and then they have a broken tooth and you fix the broken tooth. I'm talking about the comprehensive care. I'm talking about the function. I'm talking about the aesthetic needs. And sometimes these function and aesthetic needs that you're talking about with the patient, patients don't even understand it or they don't even know it, or maybe nobody even addressed it. So when you have somebody that's coming in with a repeated problems, a repeated front tooth that's chipping and breaking, or something that is not biting correctly, or sometimes patients actually clench and grind and they're actually cracking their teeth, you're not just going to be fixing the symptoms. You're going to go to the etiology and you're going to figure out what is it that's causing those problems and how am I going to address that in order to be able to address that issue for the patient. So that way you're actually addressing the issue of where things are starting from, not just fixing the problems and not just fixing the symptoms all the time and then repeating the same cycle over and over. So for you to provide a comprehensive treatment plan, a lot of times you have to address the bite issues. A lot of times you have to address the alignment issues and that overall effect of those things that are implementing to the oral health of the patients. And when you're thinking about all that, obviously the orthodontic care is going to be the orthodontic option has to be there in order to be considered for the comprehensive dental care. So let's talk about some of the cases. These are my patients, and these are the patients that are walking in my door, whether it's going to be sitting in my the hygiene chair or they're coming in as an emergency patient. And my thought process and how I'm going through the diagnosis, I want to share this with you so that way it can kind of spark some of the questions in your mind and some of the things that you are already doing amazing. And some of the things that you haven't thought about, now it's going to be something that you're going to think about. And then not only that you're going to think about how do you have this conversation with the patients. So when somebody walks in the door and have issues that you know how to fix properly, but make sure that patient is actually understanding the treatment plan and being able to accept that. So those are the things that I think it'll be really helpful for us to discuss tonight. So there's the case one, a patient walked in. He's actually, I believe, in his late 50s, early 60s, came in with a broken front tooth. And he's kind of saying, I need something in the front tooth. So our inclination initially, obviously, is of course, somebody needs to walk out with a front tooth. But when I actually take a picture of a photo of this patient, I'm looking at it going, well, it's not just the front tooth that's broken that's an issue. that is a symptom that we have here. We need to think about why broke, and then how am I going to actually fix this properly to make sure that it's going to look right? Because ultimately, whatever you're doing, your name is attached to it, meaning that whatever I do it, patients are going to smile and now they're going to say, Dr. Kim fixed this, and I want that to look nice. And I want that to last. Because for me, when patient actually puts their effort and time and investment into whatever they are doing and into trusting me to be able to deliver this treatment plan for the patient, I want to make sure that it gives that function and aesthetics for the patient. So when I'm sitting down with the patient, of course I can say, yes, so we can give you a flipper or some sort of something removable, and he's going to have to wear something like that, obviously, regardless of what it is. Or we can do a bridge because we have a missing tooth there. We got to extract the tooth, and then we're going to have to do a bridge work. And then even when I do that, I'm kind of looking at it going, how is that functions going to work for the patient? How is it going to be working aesthetically? How many teeth am I going to involve? Obviously, I'm going to do at least 3 or 4 or 6, depending on what I'm actually looking at to achieve that aesthetic function of the patient. And then ultimately, how is it going to actually look for the patient and how is it going to function really well? And I'm seeing the bite and thinking, he has a pretty deep bite. And then when those anteriors are coming against that, no matter what I'm putting in there, how he's going to hit against those teeth, it's going to become a little bit of an issue how things are. Now, these are my thought process. Now I have to actually convey this to the patient. So when I'm actually talking to the patient, I'm showing to the patient, I see why things are broken, how things are broken. Also, ask the patient what they're looking for. There are sometimes patients who are saying, just fix whatever needs to be fixed. I don't really care. Or sometimes they're like, I want to get this fixed right. I don't want things to break. And then even further, they're like, I never liked my smile. I want the color to change. I want something to be different. These are the things that you're going to actually ask the patient. And these are things patients are going to be actually responding back to you. And then you're going to be able to formulate the treatment plan for this patient. So this patient actually went ahead. This patient actually saw this past week, and we talked about aligning his teeth first because his bite has to be right in order to make sure that things are going to be. He's going to eventually go for an implant in that spot. Amazing. Even more so, if I'm going to do an implant, I want the teeth to be in the right place because once the implant is in, that's not moving. So later on, if patient wants to change their mind about, I have this implant there, but now I don't like this side of the teeth, I mean, I got to think far ahead to know where the patient's going to go and where they want to go because you want to be steps ahead in order to make sure you're giving the comprehensive care for the patient. So ultimately, yes, he wants to get an implant in that spot. I'm thinking I got to move teeth. I got to open up the space. I got to make sure the space is right for patients to be right. That 7 and 8, it's overlapped. I got to make sure that that is right. The spacing has to be right. Even that 8 and 9 space is not proper. So I want to get that going. So what I have recommended to him is that we're going to do ortho. We're going to use the clear aligners. We're going to move the teeth. And the great thing about certain protocols that you're using for that is that with the clear aligners, you can actually add those teeth to it, like with the resins for the empty space. So every aligner has a tooth added to it with resin, and then they're wearing it, and then that becomes their retainer for with the tooth as well too. Now that's additional cost, and I tell them that. So that's something that you have to build into it. How long does it take for you to do all those aligners? The material that you're going to put in it. Is it going to be 1,000 extra? Is it going to be 2,000 extra? Whatever it is, you built into it. Patient commits to it, and then that's what you're going to move forward with it. So patient agreed to it, and then he's going to be actually starting his ortho. I just approved his treatment plan so that he's going to be moving forward with it. He's super excited about it. Another patient comes in. We're going to actually try to address the missing tooth as well too. Look how misaligned the teeth are. No matter how much you're going to try to build that tooth, one, aesthetically, it's not gonna look good. I mean, is that number 2, 3, 4 area gonna really sink down to meet that really malopposing the tooth underneath of it? How are we gonna make that bite to work? So when you think about these missing tooth and misalignment, it's not just something like you're plug something in there so they have a missing tooth that's gonna be replaced, but it's more about how are we gonna make this so that way patient can actually look good and then also function better. So again, I'm going to be talking about ortho. Thing that you're going to see as I'm talking through this case is literally every patient in your chair is going to be an ortho patient because there's going to be some sort of misalignment that people are not going to be happy about, or some sort of misalignment that you're going to have to address in order to make sure your restoration, your beautiful work that you're going to do for the patient, that's going to really sustain and being able to move forward with the patient for the longevity wise. So I'm looking at that, and patient came in and wanting to address that empty space. There's a lot more to it, right? Yes, caries control, all that stuff, phase one always have to be done, of course. But when we're talking about building that, there's a lot of bite issues. There's a lot of alignment issues that we need to address. So that's a conversation that we need to have. A lot of times I find it after 25 plus years of doing dentistry, if I just like fake it and make things happen, ultimately it breaks down and then I have to fix it more later. So being that giving that initial diagnosis properly and providing the comprehensive treatment care in the beginning and walking the patient through to make sure that they're going through the proper steps, even if it takes 2 years, 3 years, or whatever it's going to be, ultimately at the end, you're going to have that great results for the patient and for you because you're having that relationship with the patient that is lifelong. And you're going to see these cases 5 years from now, 10 years from now, and they're going to be so grateful. And you're going to be so happy that you're seeing the result that has really resulted into the good result. Another thing, periodontal, you know very well, the alignment of the teeth really impacts the periodontal issues, and periodontal issues can also be impacted very much so by the misalignment. So whenever we see a misaligned tooth that actually patient's not able to really restore and manage well, and then you see those recessions and you see those periodontal problems, well, this is an ortho conversation. So yes, of course, we have to address periodontally, but at the same time, that whole perio ortho all come together and they work simultaneously. So if you don't address the periodontal issues relating to these orthodontic issues, no matter what you ended up doing, it's not going to really work, right? So again, thinking back to the comprehensive care and bringing all the knowledge of everything that's there in order to make sure the patient understands that whatever you're doing, however you're going to do, you're going to have to build a foundation first, have the proper diagnosis, and it's an ortho conversation. So I'm kind of trying to go through some of these cases because these are the cases you're going to see every day. When you're looking at it, a lot of times I think what we do is we focus so much more on restorative side of things because we see something broken, we see something that's recurrent caries, we see something that's not looking right. So we're looking at the restorative side of things. Amazing. But ultimately what happens is it is going to drive ortho. A lot of the ortho is going to be driven by restorative side of things that you want to do. And because of the ortho that's being done, it's going to bring you back to the area where you're building the foundation that you can actually build a restorative work that is going to be proper. So same thing with this patient. This patient actually had ortho when she was younger and obviously did not wear retainers, so everything has started to collapse. And these are the typical cases I see sometimes. Patients have been in ortho for 5 years or 4 years or something like that, and then things start to move, and that's where things are. And I even had a conversation this afternoon. Patient said, I had ortho and I didn't know that my teeth were moving. And before I know it, it's now here. Right. So when they're seeing their teeth on daily basis, they don't see that minute movement that's happening. We see it when we see them every 3 months, 6 months, and whatever it's going to be. So we always take that intro photo in the beginning, just like this. And then we also take it maybe 6 months, a year from now, so we can see that change of progression of things that are moving or things that are not improving or things that are actually regressing to a certain point. Because pictures are just so much powerful than just talking about it. And then if you don't have something that's going to show before and after, it's just such a hard conversation for the patient because they don't really see it. I mean, they may start to feel like something's not right or something's chipping and breaking. Those are some of the evidence that they can experience in order for them to talk about things. But when you have the photos with initial new patients or whatever, take the photos and then even like later, like a year from now or 2 years from now, you take another photo and show them what are some of the changes that has happened in their mouth because of the malocclusion and the misalignment of the teeth. It actually speaks so much volume and it gives such a story for the patient. So we always, all of our patients get a full set of photos like this. So that way, one, it's good to communicate because I can even show them some of the teeth that are discolored, some of the teeth that are missing, and some of the teeth that are carious, whatever it's going to be. You can talk about it. You don't even have to talk about it. When you show these photos, they go, ew, that's my mouth. Yeah. And what are some of the things that we want to improve? So some of this conversation you're going to have with the patients, you can have very easy conversations with just by having a photo up there, because that is speaks itself, because they're going to say, oh, I don't like that about my smile. I like that about my smile. I want to fix that. What is that great tooth over there? Why is this the front tooth have this dark line on top of my at the gum line? Like those are the conversations that they're going to start for you. And all you have to do is to start to guide them and start to educate them, because that's what's going to drive it for the patients to understand the importance of the restorative side of things. And then in order to get that proper restorations done, now you're going to have to discuss their bites and function, which is also what's going to bring the ortho. So when I truly tell you that all your patients in your practice are going to have some sort of ortho needs, it is so true. It could be just something minor as the overlapped lower anteriors that they want to correct, all the way to some of these cases. And when you do restorations for the dentition that does not have a proper alignment and proper functioning factors of the things, whatever you're going to do eventually will fail. So I think my goal a lot of times is that I have the end in mind, and then I go back and think, how am I going to get there? So I usually tell patients, it's like we're getting in the car and we're driving. If we have a destination of where we want to go, great. Now we actually are going to the same place. But now we need a map of how we're going to get there. So we have a very good idea of how we want to get there. We have different ways of getting there. We can go take the highway, go really fast, or we can go take the little side roads and back and forth and then really go backwards, because those are some patients who may not have enough financing means, and then we got to take some time in order to get there. Or there are sometimes you just take a break, rest stops, and then you got to go. So whatever it is, as long as we have a destination where we're going together, I'm fine. It can be 3 years, it can be 5 years, whatever it's going to be. I'm going to go with their speed. But we need to stick to the plan of how we're going to get there, and we're going to travel together. So that's usually the analogy that I gave to the patients when they're committing to cases like this, because it is going to take time. And then I also tell them in between as we go along, depending on how things happen, what's happening, things can happen. Like it's not going to all go as we plan. And that same thing in ortho process as well too. And I say, if that happens, then we need to stop, pause, and then fix whatever we need to fix, and we get back on track, and then we keep going. So if you kind of have that buy-in with the patients, and then you have that type of partnership with patients when you're having that conversation, now you can actually start to drive that treatment plan with the patients, because you always have that end in sight of how you want to get there and your final result of where you want to be. So when you're having this restorative driven ortho conversations, that's the conversation you're going to have. What do they want? Like, what do they want for these teeth? They may actually think everything looks fine, and that's great. But once you start to have this conversation and these type of photos are there for the patients, they start to think, because ultimately everybody wants nice, brighter teeth. Everybody wants straighter teeth, and everybody wants whiter teeth. So when they're thinking about all those things, they're going to start to think about. And now you also want to think about having the patients realize what happens when they have malfunction and then things that are not misaligned. So some of the things they don't know, because they don't even know to ask, because that's the bite they always had, is like, are you able to bite into things properly? Are you able to chew things properly? Do you chew on both sides of your mouth? Do you bite on both sides of your mouth? Sometimes patients don't even realize. You look at their face, you look at their profiles, see if they're actually having an even profile. If they have an overdeveloped one side or the other, that means they're favoring one side or the other to chew. So those are the things sometimes you want to look at and then discuss with the patient. Sometimes it's the TMD issues, right? If they overuse one side versus the other, then those are the things that's going to pop in, and they're going to tell you. It's like, I have a joint popping on one side, I have a pain on this side, but not on this side. So those are all the things that you're going to do, the palpations and whatnot, to really figure out some of their functions for the patients. And those are also leading into the conversations. Again, it's going to drive into the ortho, because you're going to be addressing their bites, and you're going to addressing their eventual aesthetics of the patients. So something simple like that, it becomes automatically like there's like no doubt that ortho is going to be a part of the conversation if you're going to try to drive these conversations for the patients. And then, of course, there's the overall dental health. Patients coming in, they're always building up. They are constantly chipping and breaking teeth. They have buildups that they can't clean. I always say, like, patients always tell you, like, I brush and floss my teeth all the time. I don't understand why I have cavities here, cavities there, and whatnot. Well, I believe them. I do believe them. I'm sure they're brushing and flossing. But ultimately, how can you brush and floss really well when you have dentitions like that? When you have crowdings like that? This person actually literally have the canine like on top, like a buccally and lingually placed with a lateral incisor next to it. Even if he's brushing and flossing, there's no way he's going to be able to actually manage that. Periodontally, that's a nightmare. This is a type of case. He's actually, I think when I started ortho with him, he was 72 years old. And he's like, I don't know if I'm going to live till tomorrow. I mean, I don't know if I'm going to live till tomorrow. So we have that type of conversation, kind of laughing about it. But at the same time, if you're going to live a day, wouldn't you want to live a day where everything is going to be nice and healthy and comfortable for yourself? So it's that kind of like a quality of life issues for the patients too. He finished the case and he's ecstatic. He's so happy. But it's something that nobody actually mentioned to him before. And he was very stubborn about it. This is my bite. This is how I want it. This is, this is my trademark and whatnot. But I always find out at the end of a case and when we do it, is that patients realize I didn't even know this is the bite that I was supposed to have. I didn't even know this is how I could bite. This is how I chew. Aesthetics to me, a lot of times with the clear aligners, is just a byproduct. I tell patients that all the time. I'm like, you're going to have an amazing smile. But mainly what I'm focusing on is to get you back to the function, get you back to the alignment that you're supposed to be in, because then you know what you don't know at this point. Because if you lived with this all along, that's all you know. So how would you know if that's is bad or good or whatnot? So what patients don't know and what patients don't know how to get there, that's, I believe, our job to be able to guide patients to get there and then have them understand where they need to go. Some people know. Some people come in and they're like, something's not right. I don't like my teeth. Like ultimately, when you look at it, you're like, they don't look too bad, but she's constantly having pain. She doesn't know why she's having pain. She can't chew. She kept saying, like, my teeth are not coming together. She had uh seen by many different dentists and they all say that's okay. She looks fine. So she actually came in asking for like how her two front teeth are too big and she wanted to have things a little closer together. But when you really closely look at it, there's a lot of issues with this case. So even though this kind of looks like it's more of an aesthetic case, it is very much a function case. It's a bite case because you can kind of see that her midline is off, her 8 and 9 are little different sizes, and her canines on the lower is actually hitting against the lateral of the upper. So she's got those canine guidance issues going on. And because of she's not having the proper lateral guidance, now all of her group function is off because her back teeth are not going to come together to be able to function together. So cases like this, I feel like, oh, this is kind of been like such an easy case, but it actually isn't. This is a harder case, if anything. The cases that I showed you prior, that looks harder, but I think that was easier one to fix because you have an extraction going and move the teeth. I mean, that was like so much fun and that was an easier case to go. But this is a much harder case. But having said that, it doesn't matter because nowadays the clear aligners that we have there are so much more functional and so much more robust that you're able to address all these issues really, really easily. And a lot of times, in my mind, when I'm looking at these cases, and I'm showing obviously some snapshots of some of the cases that I see, it's to me, it's our duty to provide this comprehensive care. If we're missing that part, if we're not having that conversation, then as a dentist, we're actually providing subpar care because we're just doing, again, whatever's broken, whatever needs to be fixed. It's just a symptom driven, and that's what we're fixing. And then we feel good for ourselves. But that's not really what it is. It's about the function. It's building that occlusion. It's making sure that everything is aligned properly. So kind of addressing the root cause, the etiology of the problem, not just the issue of the problem. So integrating this orthodontic care is going to be the most crucial thing for you to be able to provide this comprehensive care for the patient, period. So we need to really think about that. So in order to have this conversation, and I'm sure some of this conversation you're already having with your patients, great. And I'm sure some of this conversation you're like, you know what? I never even thought about that. I haven't really thought about how that was going to happen. It starts with educating patients because you are seeing these problems, you're seeing where the issues are. You need to have that initial conversation flow as we talked about it. So, of course, always address the patient's concern. If they are coming in and saying my front tooth doesn't look good, or my front tooth is broken, or I'm not chewing okay, my TMJ is bothering me, whatever, however it's going to be, you always have to start the focus on the patient care and patient concern first. That's their chief complaint. That's where you go. But then you then go back to looking at this comprehensive care that as we were talking about with some of these cases, how the ortho is going to affect the patients, how this bite correction is going to help the patient, how this alignment is going to affect the patient. And of course, the clear aligners nowadays are so much robust, as I was talking about. I usually look at it, and then if there's an absolute, wire bracket cases, of course, that's where we're going to go. But when it comes down to it, I mean, nowadays clear aligners, we can do a lot of different things with it. So I talk about the benefits of that. And then, of course, we talked about the photos that's going to really work well for the patients. A lot of times patients, when they're listening to this, they all want to do it. It's not like they don't want to do it. So some of the questions that's going to come up is some of the things that you're going to have to address that, whether like how long does it take? How much does it cost? When do I have to pay? And, what happens afterwards? Do I have to retain her forever? Like those are the things that patients are going to ask. And of course, those are the things that you're going to have to talk about in order to make sure patient understands what they're getting into and they get the proper expectations that's going to be satisfied. So this is my workflow. We actually have the conversation at chair side with the patient when they're first in. They're going to be, whether it's an emergency patient or restorative patients or hygiene patients, it doesn't matter whenever in the chair. And even sometimes when I do all these restorative work with the resins or crowns or veneers or whatever it's going to be, I always have the ortho conversations because I got to make sure that things are going to be looking right. And if patient chooses not to, and I ended up doing restorative ortho, so like some of those crowdings, and I ended up just, making the bite issues and whatnot, and having to just get the crowns on and veneers on to make it look straighter. I do it sometimes for the patients because that's what they choose to do without going through the ortho care. But I let them know that actual function of these areas are not in the ideal position because the axis of the teeth and where the vector is going to be as they're pressing onto the function of those teeth as I'm making those restorative ortho side of things, it's going to fail. It's going to break down eventually. And I let them know how and why. Sometimes I draw and where the teeth are and how they're angled, and I'm fixing it in order to make them look straighter, how things are biting, and what that means for the patients in long run. So they're aware. So that way, if later on, indeed, those restorations fail, you've told them. You've told them and they made that decision. It was an informed decision that they made. So you can make sure that patients understand. And at that point, patients sometimes want to make that change and they need to go. So sometimes it's not a conversation that you have that lead directly into them accepting the treatment right away, but sometimes it takes time. So that's okay. You're planting a seed. You're letting them know what it is. And then you just figure things out and you just document those things. And then it's a conversation. So many times we would have it. And then in 6 months from now, a year from now, they'll come back and say, I've been thinking about what you told me about this. Now I'm ready to go. So those are the things that you want to really kind of get that seed planting going for the patients. A lot of times that's done with your assistants. A lot of times that's done with your hygienist. They're huge. They play a huge role in this. So once the patient actually shows the interest and they want to do a consult, I make the consult really, really easy for the patient because nobody wants to be like sitting in chair forever and having all those things. I make sure they would collect the data on the same day when they're ready. Consult is obviously free. We take the photos, but remember how I was telling you that we take photos for everybody that's already done in the hygiene chair. So photo taking is very easy. Our hygienists already have everything done and everything is taken. Now, as far as the impressions concerned, then everything is scanned. We practically scan everybody because again, that is such a good tool for patients to see what it is and how it looks like for the patients. It starts in the hygiene and then assistance, whatever it's going to be. And we use a good scanner. So all the full mouth scan is done in less than a minute or so. Make it very quick and very simple. Making things easy for your team is going to be the key when you're kind of doing things. We see a lot of patients and we have a lot of movements happening in our practice day in and day out. So this type of process very easy. So when a hygienist says, the patient in room 4 would like to have a OrthoFX workup or, would like to have a clear aligner workup, then that's actually when somebody says, okay, sounds good. What do you have? Do you have a pan? Do you have photos? And do you have everything ready? All I need is a scan. Perfect. So then they'll drag in the scanner in there, scan, and then they're out of there. And then all the stuff is ready. So having those type of a flow that's already built into your office is going to be amazing because if it makes it so that much more difficult for them to be able to collect the data, first of all, your team's going to be upset because they're like, we already have a schedule that's running. You're fitting something in that's going to be so difficult. If you have something and it's just a matter of scanning a patient for less than a minute to 5 minutes, that's so easy, right? So have some of things already kind of built into some of your protocols of what you do, because that's what you want to do anyway. Your hygienist should have photos, should have x-rays, should have all those things already ready on these patients. So that way everything is ready to go. Now, once everything is done and then you're working on the whole side of the treatment planning side of things, a lot of the platform that you're going to use, you're going to be working in conjunction with the orthodontist or whoever that's going to be working with you so you can get that consultation going. And then now the case gets presented to the patient. Some of the platforms that's out there, such like OrthoFX, they actually have more of the forms where a patient can remote in directly and being able to see what's going on. They can create their own own logins and be able to see the whole progress of when things are going, when things are coming, when their aligners are manufactured, when it's coming, and all those things too, which makes your job easy because then they're tracking all the stuff too. So all you have to do is making sure that you're having all the stuff ready, and then they're ready to come and go, and as the treatment is progressing. So those type of flow and having to be able to recognize the technology that's out there for you, and then some of the platform that's out there that's going to work with you properly, that makes your job easier, that makes acceptance so much better for the patients. Digital plan is the key, right? So a lot of these things, taking impressions and then sending stuff in and out. I mean, I think that's harder for the patients. When you're telling the patients that, we're going to have to take a quick scan to make the whole impression, that's so much easier than, oh, we're going to take a look and, it's going to mess up your makeup, mess up your all the clothes and all that stuff. So, having a digital scan is going to be like such an investment for you. And I think you're going to love that. And then once patient reviews and approves that, then that's when the case starts. And then the aligner gets ordered, then patient makes the payment arrangements, and then now you start to schedule and then start the case right there. So it's actually, I mean, I call it a workflow, but it's actually like pretty easy because it kind of gets woven into your daily schedule and daily routine of what you're doing. So making that easy to flow like that is going to be the key. Partnering with a right clear aligner system that ease into your workflow and then works with your workflow and then make sure that all the parts are taken care of, that's going to be easy. Having everybody in your team to have the right roles and responsibilities to make sure everybody knows what they're doing and how things are going to be, that's going to be something that's going to make a great impression on your patients because they know how efficient and how amazing and professional your team are. And then also they're going to be able to trust you to be able to know, oh, they know what they're doing. And then they can make this happen because this is a big commitment when you're talking thousands of dollars, multiple years. I mean, this is a big commitment for the patient, especially when somebody comes in with a broken front tooth and they just want to get that fixed. Now we're talking 2, 3 years of a project that we're going to be doing. Yeah, it's a commitment. It's a mindset change. So you need to be able to make sure that your team is presenting things as professionally and cleanly as possible so they can follow through that. Definitely, there are going to be objections. Definitely, they're going to talk about cost is a huge thing. They're going to like, how much is it? How am I going to pay for it? Does insurance pay for it? Those are the questions that's going to come up. How long does it take? It's a huge thing. And then the discomfort and then being able to like, what do I do? Oh, I have to wear this all day, every day. So there are a couple different ones too out there. Yes, I do tell them most of the aligners are, I call it 23-hour aligners. You want to wear them as much as you can, except when you're brushing your teeth and eating. But there are also aligners that are now out there that you can only wear the nighttime and like 12 hours a day that they can wear. I have a few patients who are in that right now because these are the patients who absolutely cannot wear them during the daytime. So one of them actually is a roofer, and he's been talking about clear aligners for several years with me now. But then when we had that nighttime only, the aligners that came out, I'll just say specifically for OrthoFX, that's when actually he changed his mind because his objection was he cannot be up working and then having dirty hands and want to remove that in order to have like a sip of water or like coffee or some type of a snack and then try to rinse that and then put it back in his mouth. He's like, that's just not possible. So that was his biggest objections. And when he found out that he can only do like 12 hours, he's like, I'm in, I'm going to do that. And some patient, one of the patient, his teacher talks all the time. He's like, I just cannot talk with this in. Although that's not really true. Usually about 2 to 3 days into it, they get used to it. They don't even know that it's there, and then they get comfortable with that. But still, it's an objection that they're going to have. So if you have that opportunity for them to be able to see some of different options that are available, now that addresses common objections there too. Obviously for doctor, for you, in order to get this going, it's obviously the training requirements that you have, the cost of the equipment like scanners, and then of course your time that's going to be. I hope you realize that time that you're going to putting into it, it's something that you have to do it anyway, because it's stuff that you have to talk about with the patients anyway. It's the things that you're going to really know what is going to be good for the patient anyway. The training part of it is pretty easy, obviously. Your team already knows how to do things, especially if you're already scanning in your office. And then, of course, a scanner, that's kind of the one of the equipment that you're going to have to invest in, but it makes huge difference, honestly. I mean, not just for the ortho sake, but just in general, when you're talking about treatment planning or the whole restorative side of things, makes a huge difference. And to me, I think it's a medical legal liability thing. If I already have a photo of what it looks like and how it's going to be, and then the scan of everything, it makes it so much easier for patients to see it and it becomes their record. So I think that's something that you need to think about. And for the team, that's where you're going to actually have a lot of the objections when you're trying to implement this into practice. It feels like it's additional work. It feels like it's a lot more work. And sometimes it's an objection because you're introducing something new, something different. Just a lot of people don't like to have anything that's changing. So some of the team members are excited to learn more things and new things and like to change. And some are just like, oh my gosh, what are you doing, doctor? You're trying to do something new. But when you actually build into the workflow, you're going to find that it's going to be so much easier. And a lot of my team members like doing ortho because they actually see things and seeing things changing, and people are happy at the end. So, when you're in dentistry, how a lot of times people come in, there's a lot of fear and tears and whatnot. But when there's a happy smile at the end of it, that is actually what's making us happy too, right? So then when you're talking about overcoming the strategies, obviously making sure the patient understands what it is, the proper expectations, and having that all those objections to be met properly, that's good. Kind of showing what it looks like. I usually have a bunch of aligners. It's like, feel it, taste it, like this is what it feels like. That's, touching and seeing it. Those are the things that they need to do. And then of course for your team, just making sure that everybody's ready for it. Like for my team, everybody scans. It's not like one person does it or whatnot. Even hygienists, they all should know how to scan. So that's something that you can really train. Very easy to do, especially nowadays. The big thing is finances. So obviously the money is a huge factor. Usually a lot of the adult orthodontics not covered by insurance, we say that right off the bat. I have a set fee for the patients of how it's going to be. Some of the cases I know I have to do additional work for, then I have a set in, like I tell them ahead, this is what it's going to be. There are certain, I don't like to carry a lot of AR in my practice, right? Because I want to be able to make sure that there's enough cash flow for it. So that's one thing that I like about the platform that I use, which is OrthoFX, because they take care of the financing side of it and you get all the patient payment upfront for your practice. So you can obviously talk about that more with the team if that's something that you're looking to. But I don't like to have like, $5,000, $6,000 on the patient AR that I have to get monthly payments from them every time. I'd like to make sure that that money comes to me ahead. And then for patients, they have a lot more flexibilities and options, the financing options for the patient. And sometimes that's what makes the treatment plan to go fast for the patients too. So I think the financing part is a huge thing for the patients. Of course, money is always going to be a huge factor for the patients. So when it's all said and done, there's going to be many different options that's out there for you for the clear aligners and how to introduce to your patients and how you're going to implement to your practice. I think finding that right partner and who's going to be the right thing, provide the platform that's going to provide the best value for you and then provide the support for you. I think that's going to be the key. So understanding the quality of the aligners that's going to be actually working and then having that, I mean, plastic is a plastic, but at the same time, there's a difference of different plastics that's going to move teeth. And there are certain ones that's going to really work well to really work on those fine tuning of the things. And there are certain ones that doesn't. There are certain aligners that are just really good for closing some spaces, but not necessarily correcting the bite and functions for the patients. There are certain ones that can really be flexible in order to be able to do it, say even like a class 2 keratodiscalization or something like that. It will be able to do. If you're going to incorporate the bands and the attachments for correcting class 2 or that kind of stuff, like you got to think about how you want to do it and what kind of expertise you want to have. You want to know if there are enough of the expertise and expert teams in the back that you can talk about your cases with. Like those are the things that you want to think about because you want to be making your life as easy as possible. Like these are the things that should not make you like frown and then, pull your hair out because it's something that is going to be complicated for you. So partner up with the right platform that's going to work well with you. That's going to be the key. For me, like a big thing was the financing part. So that's why I chose the platform that I chose because again, getting that cash flow upfront was like the key. So you get the money and then you move on rather than having to involve your team to be able to have like those payment plans and you're sending out the bills every time and they have to do, I mean, money that you get upfront is always better than having to collect it later and sitting on your AR. So think about what it's going to be and what your objection is and how it's going to be implementing ortho is going to be benefiting your practice because it is easy. Patients are there. They're all your ortho patients, honestly. And you're going to see how many of a relapse patients we do so many adult orthodontics because a lot of times they do children first. And then once they see their children, they're like, oh, I think I'll do me too at the end of it. So a lot of times, and it's not the age difference to either. Like I do anywhere from like a teenager stage all the way to 70s and 80s of the patients that need those bites changed because the years of a beating on those teeth, now we got to align them properly in order to make sure that things are going to be fitting right. And then that's a good time for them to do that. So adopting this clear aligner treatment because it is so much more accepted by patients because it's so much easier, it's going to really be beneficial for your practice because again, you have these patients in your practice and you see them every day. So Monday or tomorrow, if you're seeing patients tomorrow or Monday, look at your hygiene patients when you walk in. Look what's going on in their teeth and when that's an open opportunity right there for you. Even if you're having this conversation with one or two patients a day, perfect, that's fine. I mean, make it yours and see what it is. But ultimately, you're going to be amazed what kind of comprehensive care you're giving to the patients because you're able to provide this ortho care for the patients too. So having this clear aligner and having be a part of your comprehensive care that you're going to be providing for the patient, you're going to enhance the dental care you're providing for the patients. And of course, practice growth comes with that, right? So for me, it wasn't just about like, oh, I'm going to have to do more of these because I want to make this much more money, but it's more of, wow, I need to do this because I can give a comprehensive for the patient. And then that's what drove the practice growth. And it's amazing. And the end result of the patient and the excitability and the smile that you get. I mean, those are the things that you live for, right? So I'm hoping to see that's kind of what you're seeing. And this is what's exciting you to be able to talk about this ortho and clear aligners that you're going to bring into your practice with your patients, because I think it's going to be amazing for you to be able to introduce to your practice. All right. I talked a lot. So let's see if there are any questions from anyone. I'm happy to answer. I do hygiene. I feel like the biggest obstacle is the fee. How are they going to pay for the treatment? 100%. I agree with that. I think one of the biggest objection, everybody actually wants to have straighter teeth and they want to have, I mean, it's not that they don't want it, but it's how to get there. So the cost of it is a huge thing. Usually they want to know how much it is. So we tell them the full cost right off the bat. And then usually the reaction is like, oh, that's a lot. But then we actually then break it down and said, there are many different financing options that are available. Obviously the ortho treatment itself is going to take at least a year or year and a half or whatnot. So you're going to be breaking down your payment like that or even further. So sometimes it's a monthly payment of like maybe $50 to $100 or something like that. Or it actually definitely you can use HSA money for that too. And sometimes people, when they hear it, they plan for it. Oh, if that's the case, next year I'm going to put this much money in and then I'm going to try to work on this and whatnot. So I think the financing part is absolutely the huge hurdle for a lot of patients. So those conversations, sometimes we have it at our office, but this particular platform that I use, as I said, they have many different options and almost everybody gets approved one way or the other.